My name is Dr. Bryson MCHARO. I'm a consultant pediatric orthopedic surgeon at Muhimbili Orthopedic Institute. So today I'm going to talk briefly on what we do in pediatric orthopedic. And foremost, I would like to define what is pediatric orthopedic. So this is a branch of medicine which basically deals with the treatment of injuries and musculoskeletal diseases in children and teens or in adolescents. So all children from birth to 16 years falls into these categories. And basically the condition that we are treating in this specialty are deformities of upper limb, lower limbs, spine, and injuries of both upper limbs and the lower limbs. So the other condition which we are also treating is a condition which we call them developmental musculoskeletal conditions, such as slipped upper femoral epiphysis, paralysis disease. Other conditions are like bowed legs or bowing of the legs, genovarum, genovalgum, of all arrays. By this I mean bowing of the bones secondary to nutrition, such as rickets, or bowing of the bones secondary to acquired condition, congenital conditions such as Blount's disease, whereby you have unproportional growth of the of the limbs that leads into bowing of the legs. But the other deformities, bowing that can result from injuries, such as when you have injuries to the growth plate of one side that may lead into bowing of the long bones. But also we have seen children with infections of the long bones that involve the growth plate in one side that leads also to the bone. So all these deformities are being treated at the Muhimbili Orthopedic Institute. But the other children condition that we are treating is the bone infection, the osteomyelitis, and sequelae. So infection of the bone and the complication of osteomyelitis, such as bone loss deformities, but also joint infection, septic arthritis, and sequelae. So we get a quite number of children who had septic arthritis of the hip, who have never been treated, and now they are presenting with destroyed hips, coxa vara, coxa magnas, and unbearable pain of the hips. So all these conditions are being treated at the Muhimbili Orthopedic Institute. So the other condition that we are treating here is musculoskeletal condition secondary to neuromuscular disease, such as children with cerebral palsy who present with contractures of the joint, hip dysplasias, and the other bone conditions such as fractures and so on. And the other condition that we also receive is recurrent bone fractures, and children with osteogenesis imperfecta and the likes. We also treat hip dysplasias. I think this falls into developmental conditions, the DDH, whereby we get this patient, those we get earlier, they might be treated with pelvic harness, hip spikers, and so on. But there are those who present very lately, who needs big surgeries such as DEGA, derotational osteotomies, and pelvic containment surgeries, ranging from the DEGA, Pemberton, and Salter. And we have a number of patients who have been treated with this condition since year 2015 to today, and they are all doing very fine. So the other condition that we are treating is the spine deformity, such as scoliosis, and spine deformity secondary to infections such as tuberculosis. And here I would like to spend a little bit more time to talk about scoliosis. As we all know, or as you might need to know, that scoliosis is the side bending of the spine. And basically what we mean here, when you look somebody from behind, the spine, his spine should be straight. So any degree above 10 is considered to be scoliosis. And scoliosis is basically classified into two major groups: the early onset scoliosis, the scoliosis which starts at age below 10 years. And this is subdivided into idiopathic scoliosis, congenital scoliosis, neuromuscular, and other syndromes. And then the other one is the scoliosis which occurs after 10 years, the adolescent idiopathic scoliosis, the commonly type of scoliosis that we see now at the Muhimbili Orthopedic Institute. And all these type of scoliosis are being treated at the Muhimbili Orthopedic Institute, either as a definitively or as temporary. So by here I mean, like, when we get a child with congenital scoliosis which need surgeries, but since these kids are very tiny, we are trying to prevent the further deformities by putting these children either in a MECHTA cast or any type of braces, just to delay surgeries until when they are bigger enough for surgeries. And for adolescent idiopathic scoliosis, we are treating them non-operative with spine concepts. And studies or research has shown that actually these children, 75% of them might not need surgeries, if at all, present to hospital earlier. And this calls to the need of patients with scoliosis coming to hospital much earlier for early intervention and so on. So Moi has grown rapidly from year 2015, especially in this field of pediatric orthopedic. And we are treating all range of these conditions which I have just mentioned here. And just one day I will call upon, not to Tanzania, but even to our friends nearby, to visit our country to get these very good services for pediatric orthopedic surgeries. As I mentioned, we are treating these kids in a very, very special way, because they are special, and we know the need for this particular group of patients. We all know that the children's bones are still growing, and therefore needs special care from pediatric orthopedic surgeons. Thank you.